So I thought I would just talk about some of the ketamine options that are out there for people with treatment-resistant illnesses. Mostly, I hear it's being used in treatment-resistant major depressive disorder and treatment-resistant post-traumatic stress disorder. And I'm sure there's some others that it might be effective with, but those are the two main ones that I hear that they're being used. Of course, for me, it's being used due to treatment-resistant major depressive disorder. Now, currently, there's 3 ways, to my knowledge, of doing it, at least without going out onto the street and getting it. So they have it's been around for quite a while, doing the ketamine infusions, where they use an IV and a pump, and every minute for 40 or 45 minutes, they pump in so many, like points, whatever, milligrams of ketamine into your system. And the amount that you're getting in that total 45 minutes depends on your body weight. So it will differ for people who are heavier versus people who are lighter, the total amount that you're getting. Now, initially, that's typically has only ever been used when someone is in such a suicidal state and they can't get them out of it. They're in the hospital, they can't get them out of it no matter what they're trying, no matter what they're doing. The person is just so strongly suicidal and in such a state they have to be monitored. They'll often do the ketamine infusions because it breaks that cycle. So if I remember right, it's 3 weeks, and the first week is 3 times a week, and then the second 2 weeks are twice a week, I believe. But the issue with that one, right now things are changing, but pre all this, Spravato, the S-ketamine, and clinics popping up to do ketamine infusions, that would be the end of it. That would usually break the suicidal ideation and urge cycle enough that they could then treat them, and so that's all that was done. After that 3 weeks, you're done, that's it. But they knew that ketamine did work and did help with the mood, and I guess that's where pharmacies started doing more exploration and more testing. And one of the big ones out there right now for treatment, ketamine treatment, is the Spravato, which is the S-ketamine, which is just a more purified form of ketamine. So ketamine, or R-ketamine, has both R-ketamine and S-ketamine in it. The S-ketamine has been purified to remove the R and only have the S-ketamine. And I've tried the Spravato as well. Now, it worked great. I've done a few rounds of it only because benefits would eventually cut me off. I had to stop the treatment, and then I would appeal, get approved again, restart it, and that continued. The first time around, it worked great. Things did a 180. I was thinking about bumping my hours back up to full time for work. Looking at it, even a different position in work. I was wanting to get out more, do more activities. I wanted to get out and meet people and do things. Right now, I live a more isolated life than most people during COVID lived, an isolation of life. That's how isolated I was. So that's how big of a difference it was for me to want to actually get out and do these things and to learn new things. And yeah, things were changing in a major way. And then, of course, benefits stopped. So we appealed, started it back up again. We were only approved for a 6-month period this time. And during that 6 months, it started to work again because I had relapsed during the appeal process. It started to work again, and benefits, of course, upon submitting all the review papers to get continued coverage, declined to cover again. And this time we found out that it was declined because the depression scale score was now below the specified number to give coverage for the benefit. So because it was working, because the depression was getting better, the treatment was stopped. And unfortunately, that's what this is. This is a treatment. This isn't a cure. This isn't something that you're going to take for a month or 2 months and then never take again. Not that I've seen so far, not only for myself, but from what I've read from others. Others have been on it for years, and they're still doing once a week, twice a week, once a month. It's not something you're going to get away from, even though it does help, but it is. It's a treatment. It's not a cure. It's not something that you're likely going to be able to stop. Now, you may be able to lessen the amount of time in between, but not stop. But I don't know if it's the way that the Spravato works or if it's just me, because I have a very weird reaction to medications. Things happen that are completely unexpected or are extremely rare that the doctors have never even seen before. It's just a known thing that has happened once or twice before. That kind of stuff. That's kind of where the category I fall into with medications. So when we started it up the third time, it was no longer helping. And I don't know if that was because we started it, stopped it, started it, stopped it, started it again. And that start, stop, for whatever reason, caused an issue with the effectiveness of the treatment. And so I continued on with the Spravato because at least it was doing something. It wasn't doing anything nearly what it was before. So I continued with the Spravato treatment and, antidepressants and whatnot. And then interesting enough, I decided to try a ketamine infusion clinic because I couldn't get into the hospital to do it. The hospital it's not something that they typically do at the hospital, so you have to get special permissions and approvals and whatnot to get it done. At least we did when I did it. So I went to the clinic, and one of the things that they had me do right off the bat was stop the clonazepam. They said that the clonazepam can interfere and keep the ketamine from being fully effective, which was actually new to me because I had been on the clonazepam during the Spravato throughout every time I tried the Spravato, and it never seemed to make it less effective. And I actually had to take it because for whatever reason, the ketamine triggered chronic neck pain for me, which again makes no sense because ketamine is a tranquilizer, higher doses an anesthetic. It really shouldn't be triggering pain. It should be causing no pain. Anyways, I stopped the clonazepam and we did the infusion, which helped actually. It brought me back up from being in a suicidal state again to just kind of being in a numb, indifferent type of a state, which I know doesn't sound great, but that's an improvement from where I was. And then so from there, because the ketamine infusions aren't covered in any way, I continued on with the Spravato, hoping that now that the infusions had brought me to a certain point, maybe the Spravato would pick up and either maintain or take me a little bit further. But unfortunately, that's not the case. So then we get into the third option, which I had tried on and off when the benefits had stopped the coverage of the Spravato. I would switch to this form of ketamine for a treatment in order to try and at least maintain things. Now I knew that I would relapse on it, but it was a slow relapse. So at least things would be maintained until we could figure something out. I kind of hit a point where I was just tired of everything, tired of appointments, tired of treatments, tired of having to ask this question and find out about this and talk about this. And I mean, everything in my life became centered around medical. And for a while, it was fine. It didn't really faze me that much, but I guess I eventually reached a point where I just didn't care anymore. And so I stopped the Spravato treatments since they weren't helping anyways. Stopped the Spravato treatments because I was tired of making the appointment and arranging for a ride to and from the treatments. And we switched to a Troche. So it's something that's made up at the pharmacy for a pharmacy that has a lab. They make up It's called a troche, and basically it's a sublingual. And so you'd have to do the equivalent dosage of what you would need, either from what you were doing in Spravato, or the equivalent dosage based on your body weight, again, in order to do it. And it's not going to be as exact, because the troche, as far as I know, now other pharmacies might do different strengths, but for the pharmacy I use, it only comes in 100 and 200 milligram little tabs. So you're not going to get exact, but you are going to get fairly close. And it's a little bit better. I can do that one at home, so I don't have to worry about arranging for a ride or anything like that. Now, I mean, again, it is a little bit more helpful in the way that not taking the clonazepam does help with the effectiveness of the troches, but I was still relapsing, and after hitting that mood of just, I don't care anymore. I just, you know what, society deems that regardless of your quality of life, you can't do something like the MAID program. You either got to live or you got to take your own life. That's pretty much your own choices. It doesn't matter what your quality of life is, as long as you're still breathing. Unless you're certain to die, of course. So I decided, screw it. I'm going back on the clonazepam. I'm going back on the diazepam, which Valium. I take some natural remedies that help with basically just making you tired, calm, relaxed. And I switched to taking cannabis to help with sleep. So when I'm not working, I'm usually sedated and asleep. And that's life for me. But those are the options for the troches that are not the troches, but for the ketamine that I'm aware of. Now, obviously, infusion is your best rate because you're pretty much at 100% absorption. It's going in through your veins, straight to the brain, all that kind of stuff. You lose, I believe it drops down to, I want to say somewhere between 75 and 90% when you do the Spravato nasal spray. So with absorption up through the nasal area, you're losing some of the effectiveness. Troches, you drop down to about 50%. And then, of course, if you were to take a pill, you're dropping significantly down to like 8 to 10% effectiveness for absorption. So you do lose a lot of the absorption through the troches. They don't taste the best. Luckily, you can get them flavored, but even then, they still don't taste the best. And it's something that, your saliva, as it starts to melt it builds up in your mouth, but you don't want to be swallowing it right away because you want it absorbed through the membranes in the mouth. So you've got to kind of hold it there. Sometimes swishing it around in your mouth like a mouthwash kind of helps get it absorbed quicker before swallowing it. And again, it's just a nasty taste, but it can be extremely helpful. I've seen and read from other people that, it's made a huge difference in their life. It's a lot better than the antidepressants ever worked. Obviously a lot better than ECT and a lot less intrusive than ECT, not to mention a lot less damaging than ECT can be. You just have to look out for interactions, make sure that if it is something like the troche that they will allow you to do at home, you should do several at a doctor's office where they can monitor blood pressure and make sure that you're not going to have any specific reactions, and that they don't need to make any adjustments from there. But yeah, those are the forms of the ketamine treatments that I am aware of. I'm sure there's being more done. I know there's being a lot more done on psychedelics, like using magic mushrooms, using ecstasy. So I know that the psychedelic range is really starting to open up for use with mental illness, and actually not necessarily being a cure-all, but a form of therapy, a form of treatment that can actually make a lot better or a lot bigger of a difference than medications can for people who are treatment resistant. Of course, if you respond to medications, then that's great. You don't need any of this kind of stuff. But anyways, if you have any questions, feel free to leave the comments. I'll answer anything that I can. And I look forward to seeing you next time.